I was diagnosed as an infant, so I've had EoE for as long as I can remember. I don't want to say like every childhood memory, has to do with EoE, but there's a lot. Some of my most, memorable experiences as a child related to my EoE or my anaphylactic allergies. There were procedures, there was being careful around what I was eating, and that, especially as a child, that really leaves a mark.
Max has had EoE essentially his whole life. He was diagnosed as an infant with feeding and growth difficulties. And what's interesting about him is that as he grew, his symptoms did change a bit, but his treatments really changed as the field was learning more and more about how to treat EoE. And initially he was on very restrictive dietary therapy to the point where around the age of 10 he was on elemental formula and required a feeding tube because the EoE was so difficult to treat.
I tried a lot of different things, especially getting diagnosed in the early 2000s when EoE wasn't as well known. A lot of the treatments that I tried were still kind of experimental. I tried a liquid diet when I was 9 for a few days. It didn't work out super well because just drinking this one nutritional formula and that's all of your meals, that didn't really work out well for 9-year-old me. And so after that, I had the option of going on either steroids or trying a feeding tube. And so my parents opted for the feeding tube. That's when I cut out all of my food except for the feeding tube formula. I had to put formula in there, I want to say it was 4 or 5 times a day. It didn't matter if I was in private or in public, just wherever I was, I had to do this. And it just took up so much time. It went on a little bit longer than we expected, but it helped so much. So the formula would go in through there, and then I'd add back foods over time. All the foods were cut out from my diet during the first portion, and they would be added back slowly. But it worked super well. It helped me go into remission for a time.
And then as he got older still, he was switched onto different types of medicines, which either worked partially or didn't work at all. And ultimately, when I finally saw him late in his adolescence, as he was transitioning into college, it was really an issue for him of how restrictive his diet was, how much that impacted everything that he did on a day-to-day basis in his life, how difficult some of the medications he was on were for him to remember to take. And through all of that, neither the diet nor these other medications were being particularly effective for his EoE, and he was still symptomatic.
After that, I had a couple of years which were good, and then my EoE came back a little bit. Definitely not as bad, but still something that had to be treated.
And so at the time that I saw him, we talked about other treatment options and what to do. And at that point, we tried to optimize some of his off-label topical steroid use because still there was nothing approved for EoE.
And so I had this one treatment. It was some kind of steroid. It was super cumbersome, just having to prepare that mixture every morning before class, because this was in college. And so I'd be waking up late as college students do and trying to get ready for class. And I had to make my honey mixture of, steroids and honey, and it was a lot, and I did not like that treatment very much. I think that was combined with omeprazole.
He didn't respond to that either. And ultimately, we came finally to dupilumab when that was approved for treatment in the US.
And then after that, the treatment that I'm on today, I've been using it for 2 years, is dupilumab. It started off once a week. Now it's once every 2 weeks, so even better. No, that's been working like a charm. I have had multiple clean endoscopies at this point, and it's been great. I feel like I'm genuinely recovering. I'm getting foods back.
And for Max, he also has other atopic conditions. And so it proved to be a very useful medicine for him on several fronts. But from the EoE perspective, it really was a game changer for him. All right, well, tell me how things are going.
They're pretty good. I mean, since the last endoscopy, nothing's changed. You know, it was good then. I feel pretty good. Taking the dupilumab as normal. Adding back some like foods that I was kind of avoiding before, like the dupilumab. I feel like a little bit better about, you know, trying new foods and such. Obviously nothing that's given me major problems so far, but yeah, it's good.
Okay, good. So for the symptoms, are you having any sense of food going down slowly or sticking?
Not particularly, no.
Okay. All right. And so compared to, say, about a year ago when we started the treatment, this is a good improvement for you?
I'd say so. Yeah, definitely compared to like the start of the treatment, it has gotten a lot better.
Okay. Terrific. And so it sounds like the shots are going okay?
Yes. I know we were doing like 1 week or like once a week at first, and so now I'm doing once every 2 weeks, and it's still going great.
Yeah, okay, terrific. Like we talked about, we made that change when that scope looked so good after you being on it about a year, totally. And then starting to, I guess, add back the foods as well. So give me a little bit of context in terms of how restricted things were and then what you've been able to add back now.
Sure. So before I was kind of going by like, I guess, like a white list, just like the foods that I had like really formally added back. And at this point I feel comfortable kind of just avoiding the worst foods, like more vegetables, more fruits, even though I've had some issues with like a wide variety of those. Those are coming back into my diet, which is great.
Yeah, that's great. And how is that affecting you on a day-to-day, you know, time frame, just being at school and with friends or eating out and stuff?
Yeah, no, it's been really nice. It's really taken like a lot of like the mental load off, I guess, to like really heavily consider like all of my meals and like, you know, do I have to be super picky about where I go with friends and stuff? Like it just feels like I don't have to be thinking about it like just as hard all the time. I feel like just kind of normal. I can just do things now and be a little bit more spontaneous, which is nice.
Well, that's terrific. I mean, obviously it's a goal, you know, getting you on sort of the lowest, most effective dose of the medicine, seeing, you know, the effect not only that you're feeling better, but also that, you know, you're functioning more easily and being able to go out and do those things. It sounds like it's a really big, a big change for you.
This has easily been like the best treatment so far.
And, you know, what we'll plan to do is with this dosing frequency being lower, you know, the every other week, it's great that it's still working. Generally, in about a year of being on this treatment, we'll go ahead and do another scope, and hopefully it'll look, you know, just as good as the past one. Yeah, and I mean, you've really been sort of, you know, I mean, you've had EoE so long, you've really been sort of on every treatment for it.
Yes.
And how do you feel, you know, with, say, this treatment versus when you were doing, say, medicines, you know, that had to be done every day or twice a day?
I just found those like really like cumbersome. That's really the best way to describe it was, you know, especially as like a college student with like kind of a variable schedule and like not a lot of like in between time, like between my classes and stuff. It was really hard to go through those procedures every day and keep up with it, I guess. And the same can be said about the GI tube when I was doing that. Just like there's a lot of work involved, and the you know, the once every week shot is just so much better for convenience.
All right, terrific. Good to talk to you today.
Yeah, you as well, thanks.
So we've come to a point in Max's therapy where he is doing great. I think looking back on his course, he was a particularly difficult patient to treat. He did respond to very restrictive diet, elimination, and elemental formula, but this had substantial impacts on his quality of life growing up and moving through his schooling, even into college. Had EoE that was really pretty refractory and didn't respond to any of our conventional types of treatments, and ultimately with biologics such as dupilumab being approved, he was able to obtain a great response. And thinking back over his course, I think it really gives us nice parallels to the field of EoE because, now in his early 20s, he really reflects a lot of the ways that EoE treatment has changed over the years. And I think going forward, he is on a therapy now that's at a pretty low dose for him. It's something he's able to do with minimal impact on his life, and he has a great effect with it. And so I hope going forward, he will continue to have a great response with this and continue to do well with his condition.